So, exactly what is humanism? Merriam-Webster.com defines humanism as a doctrine, attitude, or way of life centered on human interests or values. Dictionary.com defines humanism as any system or mode of thought or action in which human interests, values, and dignity predominate. This is what some students at UTSA have to say about the definition of humanism.
Humanism to me means that you're very compassionate to people, you're very understanding of them. You don't believe that you're above their level. You just basically see eye to eye and you're just a grounded person with different individuals.
Personally, I would consider humanism to be the process of realizing the different values and properties of making up the ideal human life, such as can you identify with other people's beliefs, hopes, and so forth.
I don't really know what humanism is,
So what does humanism have to do with medicine? Does it even matter? We took the time to let some people a lot more qualified than us give their take on the role of humanism in medicine.
Let's say a quality of humanism in a physician would be the quality of being able to treat the other person like a human being because of a mutual recognition of commonality, of things that fundamentally link us. You may be from a very different country, you may have a different color skin, you may speak a different language, but fundamentally there are things that are very similar about us because of our humanity, and because of those similarities, I'm going to treat you in a certain way, in my capacity as a healer, that would be different than the way I would fix a broken washing machine.
And so the particular human being has always been central for me. It's not enough to say, that's a migraine, that's Parkinsonism. You have to say, what is life like for this particular person with migraine or Parkinsonism or whatever? How do they experience it? How do they respond?
being authentically present with people. It is attempting to understand what their concerns are. It involves being compassionate and understanding.
So humanism is really more about attitudes and beliefs related to a person's illness or their health, and it's sort of, usually we think about compassion and empathy and values, and the humanities. The humanities are ways sometimes of teaching about that.
You said, why do you think humanism is so essential in treating a patient? One of the things that I can think of off the top of my mind is that building up trust between a doctor and a patient, I think, is really, really key.
They are not going to feel comfortable talking about their issues because they may feel that I'm not going to be sensitive to what they're talking about.
It's obvious that humanism is a huge part of medicine, and yet the general consensus among the public is that doctors are becoming less and less humanistic towards their patient. The high level of trust between doctor and patient is now being lost.
Yeah, well, dehumanization, usually when people use that term, it usually has to do with doctors and how they kind of lose those feelings for patients, the empathy and the compassion, and they just, they may say things that are cruel, or they may disregard what a person tells them that's important.
So, if you were to ask me in the overall sense, if I think that medicine is kind of, is it spiraling downward and being less humanistic as we go along, I would say that is a concern that we should have.
So technology, cost, and then the third factor that I think is very dehumanizing is time. And so for me as a doctor, there's more and more and more demands on my time. I have pressure to see more patients in an afternoon than I ever used to, and I also have to fill out the electronic medical record in great detail, and the standards for record keeping have gotten much different, much higher, much more onerous than they used to be. And so that results in basically being able to spend less time with patients.
The sad truth is that humanism is disappearing in medicine. But all is not lost. Christiane points out that the acknowledgement of this loss is the first step towards reintegrating humanism. Dr. O'Donnell points to a solution on a more fundamental level, selecting doctors who already possess a high level of compassion. It's only a slump for humanism in medicine. It's up to like-minded individuals to make a difference. I'll let Dr. Sachs take us out.
So the human element and talking about life with something is certainly needs to be an essential part of medicine. I think it used to be, and then sometimes in the sort of mass medicine and quick diagnosis, and even with things like brain imaging, I think there's a tendency sometimes just to give a diagnosis and forget it. But certainly that's people have to live with things.